Welcome to Health Options. Nigerian health professionals have continued to boost the image of the country by aspiring to positions at international platforms that raises the hope of Nigerians getting a better deal from the objectives behind the establishment of such international platforms by having one of their own at the helm of affairs. Dr. Bello Abubakar Muhammad, a consultant oncologist at the National Hospital Abuja, was recently elected as the president of the African Organization for Research and Training in Cancer, making him the second Nigerian to achieve such a feat, as the last time a Nigerian held that position was 10 years ago when the former Minister of Health, Professor Isaac Adewale, occupied the position. It will interest you to know that this is the biggest cancer organization in Africa with over 100,000 members around the globe. On this episode of Health Options, we shall take a look at what Nigeria stands to gain from having one of her own calling the shots at such organization in view of the nation's huge cancer burden. Is the continent looking inward or just following what the Western world hands down to it? Our guest is also in a position to tell us about Nigeria and its peculiarity in the treatment of cancer as one who sees such patients almost on a daily basis. You've heard over and over again that physical activity is important for your health. You may even know that exercise is important when it comes to cancer. It may lower cancer risk by helping to control weight, strengthen the immune system, and can boost quality of life. You will get to see some sights and sounds of the 2019 annual Walk Away Cancer Session put together by the First Lady of Kogi State, Dr. Zainab Shinkafi Bagudu. Thanks for joining us on the program. I am Rabi Abdallah. This is Health Options, and we have the second Nigerian to be elected as president of the African Organization for Research and Training in Cancer, Dr. Bello Abubakar Muhammad, here with us in the studio to give us insights into the issues raised in our opening. Welcome to Health Options, Dr. Bello, and congratulations on your election.
Thank you, and thank you very much for having me.
All right. It gladdens our heart that we once again have one of our own, calling the shots, at that organization. And the next question will be, do we as a people stand to gain anything by having ours calling the shots?
Well, yes and no. You see, the African Organization for Research and Training in Cancer, being an African organization, was formed sometimes in 1983 by African professionals and experts in cancer that are in the United States. Since then, they've been working very hard to collaborate and educate and train people in cancer care. So the organization has evolved over the years, and we have so many experts from around the world, mostly from the United States, from Africa, and from Europe. The real mission is actually to collaborate with other African countries to provide equitable and timely cancer care to patients through training, through education, and through research. Now, having said that, you do know Nigeria, being the most populous country in Africa, also has the highest number of Africans in that organization. However, some of the training and research that has been going on in the last couple of years has not cascaded down to the Nigerian society.
So, it takes us back to the question I asked earlier on.
Absolutely.
Is having you there now going to make the difference that we expect that to make, in that regard especially?
So one of the key things I campaigned on is really to make everything equitable. In other words, it should spread in terms of research, in terms of training, in terms of education. So being the highest, the highest number, it is only natural that we should have more research in Nigeria. We should have more training of professionals in Nigeria. You do realize that Nigeria will require about 3,000 clinical and radiation oncologists based on our population. We have about 70 currently practicing in this country.
Which is a huge gap.
This is a huge gap,
yeah.
a huge deposit.
Yeah.
So we want to come in and collaborate with not only the federal government, but also with state governments to see how we can quickly train professionals that will be able to take care of the teeming cancer patients in this country. So this is one of the first things that we want to do. We want to reach out to state hospitals, to state governments, so that we will see how we can actually train them. Now, beyond training, there are so many things that are required in terms of cancer care. One of the first things is to have a national cancer control program. I'm happy to note that Nigeria has one in place. Other African countries don't, and we're working very hard to support them. But implementation is such a huge gap. So we want to see how we can actually leverage on my position to see how we can actually implement the National Cancer Control Program. I am already in touch with the Federal Ministry of Health, with the DEX officer in charge of the cancer control, and we want to see what are the areas that are really urgent. Screening is the first thing that is there in the document, and we do know that we need to educate people to come out en masse so that they will be screened. So it is just not about the document. So it's really huge, and we will need the support of not only the professionals but also the policymakers to be able to implement all the things that we want to do for Nigeria.
Do we really have to wait for it? Because you see, the patients almost every day. So you know where the problems lie. You know where we are, where our shortcomings are, and where we really need to step up our acts. So can you just say it now that you have this platform?
The gap is really huge in this country because when you look at cancer care, it's a whole spectrum of events that start from patient navigation. Where does a patient even go to have diagnosis of cancer? How long does it take from the time the patient presents to the time of diagnosis? How do we reduce that? Who are the people that are involved? Who are the surgeons that will do a biopsy for a patient? Who are the radiologists that will report a mammography when they see one and recognize that yes, this is cancer and it's not a benign disease? So it's a huge thing. Unfortunately, this country does not have the National Cancer Institute that are so abundant in other African countries. Kenya has a National Cancer Institute. Uganda has, in fact, they celebrated their 50 years anniversary 2 years ago, the National Cancer Institute. We hope that government will provide that as an enabling environment to train quickly people that will go out there and support cancer patients. It's so enormous that I keep saying that we have not actually started. If I start rolling out the statistics that you said, it will scare a lot of people that are we really serious? I'll give you an example. Nigeria, let's assume we're 180 million and we require 180 machines, radiotherapy machines. Currently we have about 4 that are functional, just 4. So you can imagine the huge gap between 180 and 4. We haven't started. Kenya, that's having a population of about 45 million, they have 11. Rwanda, with a population of 14 million, they have 3. So other people are making strides, and it is important that we carry everybody along, not just government, but NGOs, and private sector entrepreneurs to come and support cancer care. People think that treatment of cancer is a bad business. It is not. Most of the people that go out of this country go to India, or they go to Dubai and so on. They go to private hospitals and they spend a huge amount of money to get treatment. At the end of the day, they still come back here. Why can't our entrepreneurs come and build hospitals so that people don't need to go to India? People don't need to go anywhere else.
Okay, let's look at where we're coming from. It used to be so bad, and you will agree with me that the current administration had actually done a few things to make a difference.
Absolutely.
So you are in a better position to
absolutely.
Tell us that.
So this administration came because, like you mentioned, Professor Adik Azewale is a Ghanaian oncologist of repute and was the former minister, and he saw the gap. In fact, when he came, he saw that there was a radiotherapy machine that was staying in the crate at the National Hospital. He called me and said, this is unacceptable and it's almost criminal. Let us work together so that we can institutionalize it. And we were able on the 1st of December 2017 to start working with that machine, and it has worked since then. In fact, we have received a second machine thanks to the former Minister of Health. There is plans to provide another 14 radiotherapy machines. From the last count, I've been told that everything has been put in place. They are building the bunkers, and the machines will be ready hopefully by next year. That's 14. Now, if you subtract 14 out of 180
I'm aware
million.
Of the one in Lagos too.
Yes, so the one in Lagos too, out of the 3, 2 are already functional. That's why I keep telling you that there are 4 functional radiotherapy machines. Now there will be 2 more in Ibadan, there will be 2 new ones in Zaria, and then I think Ife and 2 other centers. So yes, government is working very hard, but federal government alone cannot do it. I do realize that also the Kaduna state government is working very hard to establish a radiotherapy center, which is a good thing. Kebbi state government is also trying very hard to establish a radiotherapy center. Anambra state as well, and also Kano state. So we want, as an organization, we'll try to support them, collaborate with them so that we can provide expertise. The problem of this country is that most of the people selling equipments do come here and give exorbitant fees because we don't have people, the experts that will do proper negotiation and give access pricing. That is where our organization will come in. We will leverage on my position and invite experts that will get a fair deal for the equipments that we are buying, and also make sure that there is maintenance policy, and then we have capacity to use those equipment.
If you look at what is covered by our health insurance at the moment, it's still a far cry from where we should be, and a whole lot of people out there simply can't afford cancer treatment. Take on that.
No, that's about catastrophic health fund. About 1 billion naira is put in the next year's budget to be to provide for treatment for indigent Nigerians. About 1 billion naira. This is really the right way to go, even though it is still not enough. We hope with that initial push, government will be able to institutionalize a proper health insurance that will provide for cancer care in this country. The other thing that we have actually we've done at the Federal Ministry of Health level, though I'm not part of the Federal Ministry of Health, but I participated in what is called the access pricing, where the Clinton Health Access Initiative was able to approach some pharmaceutical companies to get access pricing. So we've been able to negotiate some drugs at 20% of their market price. Already those drugs are in the country, they are in the hospitals. People should access them at 20% of their market value. And if we keep doing this, then we will be able to help our people to afford cancer care. Otherwise, I don't see any sincere person that's an average Nigeria able to afford any cancer care in this country.
Let's look at the issue of drugs now. Like you heard me earlier on, I said, do we always have to, look forward to what the Western world hands down to us in terms of drugs? And you have the novelties, you have all of those companies and what have you. In terms of research now, what efforts are we putting into towards, looking inward to develop solutions that that are peculiar when you take into consideration our peculiarity as Africans and
exactly. So one of our mission is actually research. As the name goes, IOTIC stands for organization, African Organization for Research, among other things, is to make sure that we are able to institutionalize framework for research in Africa. Until now, most of the research that are conducted for Africans are done elsewhere. You'd be surprised to note that some of the specimens are taken to the United States from Nigeria, from Rwanda, from Burundi, and so on. And they do research and they say this is the prevalence of this type of cancer in Africa, not considering environmental factors and many other factors of transporting the specimen and so on and so forth. We in IOTIC are trying to make sure that we have provided capacity in Africa so that research can be conducted here in Africa for the benefit of Africans. We have expertise, we have provided some institutional framework, and we're going to work with the African Union to see how we can actually institutionalize it. There is the head of government's meeting in February, and IOTIC is going to be present to provide, to present to the head of government, African head of governments, what we think should be the framework for cancer control in Africa.
I must bring up the issue of integrative medicine now, even though you're from the Orthodox. Well, I'm interested in knowing what you feel or what you think about the fact that we have had people coming up with claims of, cure or remedies for, terminal diseases such as cancer, and their claim had been the fact that they've not been given, fair hearing or the opportunity to really, optimize or maximize what they have come up with.
So that is also true, and I've had opportunities to talk to so many of those people that claim to have cures for cancer and many other diseases. Now, what is lacking is the framework. You see, most of the drugs that we use as orthodox are mostly from herbs. They are being synthesized, and then there is clinical trial, and they are validated, and so on and so forth. The National Institute for Pharmaceutical Research and Development in IDU is created for that singular act. Now, I do not know how many research they've conducted in terms of getting some of these drugs or herbs that claim to have cure for cancer. It is one of the areas that we are going to look at, not only in Nigeria but across Africa, because the claims have been here. And we want to believe that, yes, some of the claims may be true, but they need to be refined so that they are given properly in the right dose at the right time, because dose defines poison. A small dose can cure something, but maybe in a large dose it becomes poison. So these are some of the processes. What we have realized as an organization is that a lot of those people that have the claims had no opportunity or platform to be able to take up some of this claim at international fora. We want to provide that platform for them so that they can come, discuss what they have, and then we subject it to scientific analysis.
Okay.
Hopefully we'll be able to get something out of it.
Okay, what's the duration of your tenure so that at the end of it we can evaluate and see the difference you've been able to make?
So it's only 2 years,
okay.
But my plan personally is to be able to institutionalize certain things so that anybody that comes will be able to add on it, not to just change it.
Okay.
So the institutionalization of frameworks is what we are going to do in the next 2 years.
Okay, thank you so much, Dr. Bello Abubakar Muhammad, for joining us on Health Options.
It's a pleasure to have me.
Regular and physical exercise has been scientifically established as providing strong preventive medicine against cancer with the potential to reduce incidence by 40%. We bring you the sight and sounds from the 2019 annual Walk Away Cancer Session put together by the wife of Kebbi State Governor, Dr. Zainab Shinkafi Bagudu.
We need so many more treatment centers. We need more funding allocated, appropriated to the treatments. And then we need to look at having more regional treatment centers.
And this is where we round up this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Bye for now.